Greetings. My name is Dr. Beth DiNapoli from Otsuka Medical Affairs Team, and I will be providing you with a brief introduction into opioid use disorder. As many of you are probably well aware, the U.S. is facing an opioid crisis, and the impact of this is far-reaching. So for those struggling with the addiction, it can really turn their lives upside down. Moreover, it can also create chaos for families and communities. I believe one of the important first steps in addressing the opioid crisis is education. So today I will describe what opioid use disorder is, review factors that cause opioid use disorder, and end with an explanation around diagnosing and treating opioid use disorder. So let's get started. Opioids include most prescription painkillers, as well as products of the poppy plant such as opium, morphine, and codeine. These medications are usually prescribed to help control pain. However, they can also produce feelings of happiness and sedation, which may lead a person to continue to take or misuse these drugs. So for example, a person may increase their dose to get these desired effects of happiness and sedation, which can in turn lead to serious health and personal problems. This is also an example of a person who has lost their tolerance to opioids. This is the need, again, for higher doses of the drug to produce desired effects like sedation and happiness. And repeated misuse of opioids products produces tolerance as well as long-lasting cravings. An abrupt discontinuation of opioids after long-term intense use produces symptoms that are opposite to those that you might see during the drug use. These are known as withdrawal symptoms. Those can include feelings of pain, physical symptoms such as sweating and joint aches, as well as mental health symptoms such as anxiety and restlessness. Here you can see some of the heartbreaking numbers associated with opioid use disorder. Approximately 2.5 million Americans have an opioid use disorder. 4 in 10 Americans know someone who has been addicted to prescription painkillers. Not only that, but opioid use disorder can also occur alongside another mental health disorder, such as major depression or anxiety. The exact cause of opioid use disorder still remains unknown, but it is likely due to multiple factors. As previously discussed, there are rewarding medication properties of opioids when taking them, but when they are taken away, withdrawal symptoms can occur. Nearly half of the vulnerability to any addiction is attributed to genetic factors. And then environmental factors such as stress and access to opioids, as well as developmental vulnerabilities and comorbid psychiatric disorders are also factors that can attribute to or cause opioid use disorders. Opioid use disorder is primarily diagnosed based on history provided by the patient, as well as a thorough assessment that may include a physical examination and potentially a urine drug testing. The provider may also ask the patient to complete a questionnaire that may assess for withdrawal symptoms. There are specific diagnostic criteria for an opioid use disorder, which you can see in the table. I won't read through all of these, but this can include a person may spend a lot of time trying to obtain, use, or recover from an opioid use. Opioid use gets in the way of doing important tasks. Consistent wish or unsuccessful effort to cut down or control opioid use, and continued opioid use despite causing personal and or social problems. Then you can see at the bottom of the table there that if the person has 2 or 3 of these items together in the same 12 months, the disorder is considered mild. 4 to 5 items is moderate, and 6 or more is severe. So generally speaking, counseling with medication is more useful than either of those treatments alone. An example of this is the medication-assisted treatment for opioid use disorder. So this is a comprehensive approach that combines approved FDA medication with counseling and other therapies to treat patients who have an opioid use disorder. Specific medications that help opioid use are known as opioid agonists. The goal is to slowly replace the opioids with these treatment drugs. It is recommended to avoid stopping opioids cold turkey. There are also many counseling or therapy approaches that have been shown to be helpful. These include therapies that help change bad thoughts and behaviors, as well as strategies for preventing relapse. Education about the disorder is also extremely important. There are other treatments that should be considered or integrated into the treatment plan, such as providing physical health care and continue to monitor for substance use. So to summarize everything, an opiate use disorder is a bad pattern of opioid use causing significant impairment or problems. The exact cause is unknown, but is likely an interaction of genetics, medication, environmental, and developmental factors. A diagnosis is made by a physician after performing an evaluation, which may include a physical exam and urine drug testing. And lastly, combination of medications, therapy, and other treatments may help improve symptoms. That concludes the introduction to opiate use disorder. I appreciate you listening, and hopefully you found some of the information helpful. Please feel free to continue to explore the patient and caregiver corner for additional resources. Thank you.